Good morning, everyone.
Morning.
All right, so I can report to Queensland that today we've only had 2 new cases overnight. This is a good result, but of course we're not out of the woods yet. We have 2 new cases. One person is linked to one of the other cases, and case number 9 is a male child, but Dr Young will give us more details about that. So we now have 16 active cases in Queensland. That brings our total to 1,105, and the number of tests in the past 24 hours is 6,875. So of course our message to Queenslanders, especially in those local government areas I mentioned yesterday, is that if you are sick, stay at home and get tested. We would like to see more tests being conducted. I understand it is bitterly cold out there at the moment, but of course if you do have any symptoms, now is the time to get tested. In relation to the testing of the staff members at the Brisbane Youth Detention Centre, we've had 202 results that have come back negative. Out of the young people at the Youth Detention Centre, we've had 111 out of 131 come back negative. I've asked the department to prioritise the testing of the staff members and the young people, and I would like to update Queensland tomorrow with a complete list of the results of those tests. Dr Young will also talk a little bit more today about the restrictions we've put in place. We've had to act very quickly and swiftly in relation to, of course, aged care, hospitals and disability accommodation providers. This is going to be tough on a lot of families. I please ask for your patience and your understanding during this time. This is about the protection of your loved ones first and foremost, and as soon as we can lift those restrictions we will, but we have to put those measures in place because the last thing we would want to see is an outbreak at any of those places. Can I also reassure the public that businesses have in place COVID-safe plans. So it is absolutely fine for you to go and visit your local cafes and restaurants and businesses where they have COVID-safe plans in place. Also too, I know that there would have been a lot of disappointed people out there. They would have had parties scheduled to be in their homes last night. I apologise for that, but of course we have to put public health, community health, your health first and foremost, and that is exactly what we did by taking that swift action that we had to do yesterday. So we're not out of the woods yet, we're taking it day by day, but those results overnight are very encouraging, and that's why we're prioritising those other results as quickly as possible. The other thing that we'll be putting up today is a public health alert of a number of places across southeast Queensland. This is the work that our contact tracers have done, and it is very important that members of the public and families familiarise yourselves with these lists very carefully to see if you have been to one of these places. It's a very comprehensive list. We'll be releasing those 2 pages following this press conference, and please take the time to have a look. If you have been to any of those places and you do have any symptoms, it is very important that you go and get tested because we all have a duty to ensure that we are protecting not only our families but also the broader community at large. And there's a whole range of issues. I can't go through the list here at the moment because it's too comprehensive, but it does involve a whole range of suburbs, including Browns Plains, Mount Gravatt, Forest Lake, Marsden, Greenbank, Crestmead and Camp Hill, just to name a few. There are more suburbs, of course, there, and the times that people went to those particular establishments, whether they are takeaway shops, service stations, shopping centres, but please take your time to have a look at that list, and we'll be trying to put also out a community alert to the public to make sure that they are familiar with that. So look, I might leave it there and hand over to Dr Young and then the Deputy Premier, and then of course you'll hear from Bob G, our Director General from Youth Justice, and our State Disaster Coordinator will give us an update about borders as well. Thank you.
So first, thank you to all of those Queenslanders who came out yesterday. It was a very cold day for Queensland, and I know that was a big effort. That's really important, and if Queenslanders could keep doing that. The most important message is, if you're unwell, to stay at home and to get yourself tested as soon as you can. That is really important, particularly as we work through this particular outbreak. So this outbreak, we're now up to 9 cases. The last 2 cases were confirmed late yesterday, overnight, but both of those cases are related to one of the 7 cases we already knew about. So we don't have any expansion of that cluster, which is good news, but it's far, far too early for us to relax. For the next week, it is just so critical that if anyone's unwell, they immediately get themselves tested so we can confine this new cluster as much as we possibly can. Police colleagues have done a brilliant job over the last 24 hours going out across the state to find any of the youth who've been discharged from that facility since the 22nd of July, and we're gradually finding all those and testing them. None of those youth have tested positive, which is really good news for across the state. We will continue to test all of the youth in the centre. We've nearly managed to test all of them and get results. There's just a few outstanding, but all of the ones tested to date have tested negative. And similarly, we've been testing all of the staff. There are a lot of staff who work in that centre, over 500, not every day of course, but we need to manage all of those. And those staff work in multiple other places. This is why this cluster is such a risk to us, and we need to really focus the next few days. So far, I'll just remind you of the suburbs that the cases so far live in, but they've been to many, many different places, as one would expect. For a while now, we've not had community transmission, so people have been moving around the community broadly, which is very, very appropriate, and we hope to get back to that position soon. But the suburbs these people do live in, Bundamba, Marsden, Carindale, North Ipswich and Forest Lake. But as the Premier said, there'll be a list going out of all the places that these people have visited, and they've visited a lot of places outside those areas. So today we now in Queensland have 9 cases related to that cluster. We have a total of 16 active cases across the state, with 1,105 people to date in Queensland having had COVID-19. There are 5 people in hospital, none in intensive care, and yesterday we tested 5,388 people, and I thank every single one of those people for coming forward to get tested. And I hope the weather's a bit better today so more people can come forward and get tested. We've got all of those clinics open. They're ready to have people come forward. The queues were not long, so please come forward and get tested if you've got any symptoms at all. Remember, it's people with symptoms that are critical. If you're not sure, of course, come forward and get tested, but if you've got symptoms, you are the people we want to test. You are really important for us to test. Thank you very much.
The fact that both of these additional cases are household members of existing known cases is very, very good news for Queensland. It means that they were already quarantining. But we need to do a lot more testing, particularly over the next week to 2 weeks. In the past 24 hours, we did 6,875 tests, of which 3,089 are across those HHSs we're concerned about, Metro North, Metro South and West Moreton. You'll recall that in our rapid response phase to the last outbreak, we peaked at around 20,000 tests a day. And so we need to test a lot more people to be confident that we are finding any cases that are out there. That's why we are distributing a list this morning of a large number of locations where the known cases, now known cases, have visited in the period in which they're believed to be infectious. We would urge everyone who lives in Brisbane and Ipswich to check that list, and if they've been to any of those places, to monitor their health very closely. If they have any symptoms whatsoever, they are the most important people to go and get tested, and in doing so they will assist us in lifting that testing rate. In this rapid response stage, we need to be testing a lot more people than we did in the last 24-hour period.
Thanks, Premier. Good morning, everyone. Can I thank everyone for coming forward to be tested and encourage everyone to do that needs to be done, particularly my staff. They've done a great job. We're thinking very much of the staff that are tested positive and their families. Can I give an operational update about how the centre intends to continue to operate? I'm very confident after the government gave us the powers earlier this year to be able to bring in an entire new workforce. So this week, midweek, we will swap in a completely new workforce led by the Department of Youth Justice. An executive director will come down from Townsville. There'll be well over 100 Department of Youth Justice staff to move in. Police service, in fact, a superintendent and others will come in as well. A man I've worked with for over 35 years, and so we're well placed there. The Department of Corrective Services as well will help us, as will a range of other agencies. So what we're going to do is swap in a completely new workforce. Can I give an update about operations out at the centre? The young people are moving in and out of their cells in a very structured and targeted way so that they're not just in their rooms. So they're back indoors in their little sections doing activities like table tennis, etc. And can I thank them for the way that they are behaving and assure their families that they are getting the very, very best support, and can I thank Queensland Health for their support. Thanks, everyone.
Good morning. I may start, if I may, with an overall update around our operations in COVID. So in the last 24 hours, we have seen 56 flights come into Queensland, 2,998 passengers have been processed, 5 refused entry. At our road borders, we've seen 3,072 vehicles. We have turned around 162 persons. From that, we have placed 271 persons into quarantine, which means at present we have 3,013 people in hotel quarantine within Queensland. Can I now move on to what's happening in terms of the new restrictions that came on yesterday? Obviously, yesterday morning people were a little confused what was happening. Our officers and other parts of government have been out making sure that people get the message around what was required of them. Overall, the compliance has been very good. We encourage the community to make sure that you stay connected with the messaging, with what's happening. These things can change rather quickly, as it did yesterday. We need you to work with us. Overall, the compliance has been very good. And we encourage people to keep doing that. We did some fairly detailed policing of our safe night precincts, our liquor licence premises over the night. Overall, the compliance was quite high. We took no deliberate action. We had to give out a few warnings. What we're seeing is that people will do the right thing, but too often we're having to remind them. So people out and about in the community are not thinking enough around what they should be doing in terms of their social distancing, and that includes when they're out socialising. So what we're seeing is very high compliance within the licensed premises according to their COVID safe plans, but still people that are outside are not necessarily doing what we would like. So we'll continue to do that, but the message to the community is please take responsibility for this. At the moment, while we try to deal with this outbreak, we really have to be on top of our game. So the only formal action we've had to take in the last 24 hours has been 2 on-the-spot fines for people misusing the X-Pass, trying to get into Queensland when they weren't in fact entitled to do. Look, so overall it's tracking very well. As the Chief Health Officer mentioned, we have a task force working on locating all of the children that have been released. We have located approximately half of those, and we aim to have all of them located and tested within the next day. Thank you.
Are there
any questions for anyone?
That child that's tested positive, can you give us any more details on how that child contracted it?
I can't, but what I can say is my understanding is that the child is doing very well.
The two new cases, are they both from the same household or separate households?
They're related to the same family.
I appreciate we've got that new PPE stockpile.
I'm so glad we've got that stockpile, yes.
We have health workers across Brisbane Ipswich being instructed to wear full PPE. Will there be enough?
Yes, we have more than enough. That's why we've got this huge, enormous stockpile, and I'm so glad that you got to see it the other week.
Is there a reason for the delay in getting to those final residents? I think you're short by about 20, testing the last 20 of those 130 residents. Is there a particular reason for that?
Sorry, in terms of the staff and the young people?
Yeah, there's a certain number of those young residents who haven't been tested.
I think there's just such a large number of tests that are happening across the region, but we've asked if it can be prioritised. Yep. And of course there's private and public labs involved. Yep.
In terms of keeping cafes and businesses open,
yes.
obviously that's a huge priority for the
economy.
economy.
Absolutely.
But
yep.
in terms of,
yep.
I guess, the concern that we could have much more community transmission because of such a long incubation period, are you concerned that you may have to shut businesses down?
We have no concern about that at the moment at all, so please do not be alarmist about that, because the businesses have COVID-safe plans in place. This is a much different environment to where we were when the pandemic first started. Our businesses have done a lot of work with the Chief Health Officer, and we are confident with the plans that they have in place. What's very important is that people continue to do their social distancing when they're out and about, and of course avoid large crowds. So if you're, like I said the other day, if you're going into a shopping centre and it is crowded, avoid the crowds. I mean, we all have to do our part here. Whilst I'm here as well, can I also just mention too, I was planning to take the Cabinet to the far north to be in Cairns on Monday. Can I just say to the people of far north, you are not forgotten. I understand that there are a lot of issues that you want to talk to the Cabinet about. I understand that the far north has been impacted by international tourism being stopped, and of course you are a key priority for our government. So we have postponed that until next week. I hope the people of the far north would understand that I have to keep the Cabinet here to prioritise this. It is absolutely critical we get on top of these issues over the next week.
Premier, just a moment ago you said that people should be avoiding crowds in shopping centres and such.
If they see a larger number of crowds, like they just need to keep their social distancing.
There are these large crowds forming in places like shopping centres, so it's confusing to say that you can only have a maximum of 10 people in a group, even in an outdoor area, but you're also saying, yes, there is crowding in certain places like shopping centres.
But businesses have COVID-safe plans in place. So what we're saying is, if you are seeing crowds, you should avoid those crowds. What we have seen in southern states, especially like in Victoria, a lot of transmission happened in the family homes where large families were gathering. That is why we have immediately reduced those gathering numbers in homes. So we've looked at the evidence and we're acting on the evidence in the best interests of people.
Is the government looking at it doesn't sound like we're looking at restrictions for cafes and businesses, but are there any other restrictions in general that the government is considering?
Not at this stage, no. We are focused on getting the testing done, but also too, it is absolutely imperative that people in South East Queensland look at that list and go through that list and check if you have been to any of those areas recently, and if you have any symptoms, today would be a good day to go and get tested.
How do you think this little wasp goes?
And that's where we'll leave the press conference there, being led by the Premier, Annastacia Palaszczuk there, just updating the nation that there are now 16 active cases in Queensland, 2 new cases linked to the Brisbane Youth Detention Centre cluster.